right, you're welcome to our today's class. We'll start in few minutes time, few seconds time. So I want to welcome all of you. Without wasting time, we start our today's class. Today we are going to stay for at least 3 hours. Today, our first course for today will run between 8 and 9 p.m. and that is actions and uses of medicines. So the topic is cardiovascular system drugs. From where we stopped in our last class. So after that, we'll take a short break. We'll come back 9 to 10 p.m. We go over to the second course for tonight. That is pharmaceutical calculations, dilutions. So from 10 p.m. to 11 p.m. by God's grace, we go over to physics. And the topic is, we start from where we stopped in equations of uniformly accelerated motion. So that's how our live lectures today will look like. In between these hours, we're having between 8 and 9 p.m. we're having some short break in transmission, because I noticed that TikTok, I still don't know the cause, but I noticed that sometimes you may be live without even knowing that the thing has disconnected. So because of that, after some minutes, I'll just go, cut, then come back again. Please bear with me until I find out what the cause is. All right, so without wasting time, we go back to what we have. The first for today is, specifically the code is AM321, that is actions and uses of medicine. The topic today is our 29th. Okay, still on cardiovascular. This should be our third contact on this topic, part 3. This is our third contact on this topic, cardiovascular system drugs, part 3. So in our last class, we stopped at cardiac glycosides. So today we'll move over to the diuretics without wasting time. So diuretics are, our reference book for today, Our reference books for today are, the first one is the Pharmacy Technician Foundations and Practices by Mike Johnston, Karen Davis, Jeff Greker. So, and we also have Index Drug Information Book, Index. So these are our reference books for the first lecture. So let's continue. So diuretics are also known as water pills. So what actually happens is that, during the congestive heart failure, there is edema. That one is normal. Because of the what? Because of the heart could not pump all the blood presented to it. So there is backlog, there accumulation of fluid, blood. So generally there will be edema. That one is constant. And also that accumulated fluid or blood in the vessels could also increase the pressure. So these diuretics are also used in congestive heart failure. They are also used in hypertension. So basically what happens is that they eliminate excess sodium and water. Diuretics eliminate excess sodium and water. this pass through the what? The urinary tract. So basically, you know that the retention of sodium leads to what? This issue of what? Water and what? Increase in blood volume, which ultimately causes what? Edema. We've talked about this in our last class. So both the water sodium retention will lead to what? Aggravated what? Congestion and blood circulation problems that they associate with what? Congestive heart failure. These are the things we discussed in our last class. I'm just trying to do a kind of record of what we did. Okay, now let's continue. So basically, anything that will lead to less sodium will automatically lead to what? Less fluid what? Accumulation in the blood and lower blood pressure. And diuretics will do that. So less volume means less water in the blood and lower blood volume and what? Blood pressure. So diuretics, what they do, they lower the what? The blood pressure. By doing what? They decrease the what? Blood volume. I've said it before now. So of course, when the blood volume, because of the fluid that eliminates, the blood volume will come down. So the pressure, remember, pressure is the force. Remember that the blood pressure is the force of the blood on the what? The walls of the what? The vessels. The walls of the artery, remember. So when the heart is at rest, and when the heart is at what? Is beating, that is at diastole and what? Systole. Automatically diastolic pressure and what? Systolic what? Blood pressure. Okay. So this physically that of what? Using treatment of what? If heart failure and what? Hypertension, because what? Because of this mechanism of what? So diuretics are both hypertension and what? Congestive heart failure. Already mentioned that diuretics are also as what? To a layman. Okay. Note level should be monitored while playing what? Diuretics. Okay. With hypokalemia and hyperkalemia in our last lecture. So do that. Please watch the second lecture on cardiovascular system drugs on our YouTube channel. You understood there. Alright, let's continue. So there are 4 main diuretics categories I want to do what? 4 main categories diuretics want us to do what? And they are as follows. Number 1 is what? Thiazide diuretics. We should look at low diuretics. We should look at then we have diuretics, potassium that carbohydrate, sorry. Under this one, you have your thiazides, chlorothiazide, hydrochlorothiazide, and what have you. That here, let's take the one after the other. So, so here, under here, we have the chlorothiazide, we have hydrochlorothiazide. Here, then we have meta. So we have thiazide. Popularly known as what? HCTZ. Let's continue. So, but what did they actually do? Let's bring that first. What did they do? Basically, as I said before now, they are also using what? Treatment of what? Congestive what? Heart failure. Basically, they have this mild to moderate diuretic effects, and they are most commonly for what? CHF. Now, they are indicated for what? Treatment of what? Edema, hypertension, congestive what? Heart failure. So, I wouldn't want to go deep. I'm trying my best to meet myself to the scope of the course in question, actions and uses of what? Medicine. I'm trying to do that. Then also in renal what? Impairment. They're also using what? In patient with what? Renal impairment. Basically, they have mild to moderate what? Diuretic what? Effects. Moderate diuretic effect. I don't want to start going deep into the making of action. When we go through pharmacology, pure pharmacology, we go into that. I'm trying my best to do that. Now, the loop. Okay, here I mentioned chlorothiazide, hydrochlorothiazide, and the metolazone is also one of them. Now, I just want to pick up one or two things here concerning this. Talk about the dose form available, dose form readily available. Then talk about the dosage. With these three, I think we are good to go. I'll talk about the dosage form available, the strength, and the what? The strength and the what? The dosage. Now let's look at chlorothiazide. Chlorothiazide, we have it in 250 milligram, 500 milligram, and the tablets, mainly tablets. Chlorothiazide tablets. We have chlorothiazide as well, tablets. Then at 500 to 250 milligram, 500 milligram. We have suspension. We also have it as what? Suspension. And suspension, we have it as 250 milligram per 5 ml. 250 milligram per 5 ml. We also have it as injection, 500 what? Milligram. As tablets, we have it as what? 250 milligram, 500 milligram. Then as suspension, we have it at 250 milligram per 5 ml. Then injection, we have it at 500 what? Milligram. Then adult dose, mainly 500 to 500 milligram to 1000 milligram daily. Adult dose of what? Chlorothiazide. 500 to what? 1000 what? Milligram daily in average. Then hydrochlorothiazide, this one is very common in this part of the world, very, very common. Hydrochlorothiazide. Then hydrochlorothiazide as tablets. So we have it as what? But the most popular ones here are in tablet form. We have it 25 milligram, our popular Hydrex here. Hydrex is Hydrex, then Acidrex, and what have you. Let me not go more. So 25 milligram, where it at 50 milligram, and that's what? 100 milligram what? Tablets. 100 milligram tablets. Then also, we have it at 12.5 milligram. 2.5 milligram capsule, though not that one here, but in some other part of the world, capsule. Then for solution, you have it at 50 milligram per 5 ml. 50 milligram per 5 ml solution. 50 milligram per 5 ml solution. Okay. So what is the dose? The average dose, adult dose anyway. Then, when the patient has edema, we take 5 to 100 milligrams daily. Edema, for hypertension, without obvious edema. When I say now, you start going over to maybe congestive heart failure and what have you. Basically, in normal patient, no obvious edema. In such person, you can take 2.5 milligram to 50 milligram daily, 12.5 milligram to 50 milligram daily. But in edema, it can be taken on daily basis, 50, 25 to 100 milligram daily. Alright, so that's for what? Hydrochlorothiazide. Then for metolazone, you have it as 2 milligram tablets. You also have a 0.5 milligram tablets. You have it as 5 milligram tablets. Then as what? That's 0.5, 5 tablet. The same thing in edema, but you don't use the same with the hydrochlorothiazide. But in edema is 520 milligram daily, 5 to 20 daily, while in hypertension is 2.5 milligram. I mean, in hypertension, the dose reduced, but when the edema, the daily dose is what? Increased. Please, let's note that point. Then I want to talk about clothalidone. Clothalidone. Mention thiazide, hydrochlorothiazide, metolazone, clothalidone. Under this one, we have it as what? Tablets, 25 milligram, 50 milligram, and 100 milligram what? Tablets. 25 milligram, 50 milligram, and 100 milligram what? Tablets. The same thing again. We also have the dose in edema and the dose in what? Hypertension without obvious what? Edema. In edema, we have 50 milligram to 100 milligram daily. But the hypertension is also reduced to 25 to what? 50 milligram daily. 25 to what? 50 milligram daily. Okay. So we also have, I think let me stop here for now. So we don't waste time. Let me move to another group. The loop diuretics. This one is common from the name where the act is common. So they act where at the what? Loop of what? Loop of what? Henley. So that's where they act. So actually, these ones they work here at the loop of what? Henley. That's where they act. So basically, what actually happens is that we have in thiazide diuretics, this one also aids in what? They are mild and what? They are mild and they moderate. Sorry, they are moderate to what? Potent what? Diuretics. They are moderate, but they're also what? Potent. They are very, very what? Potent. Okay. So they're also used for what? Acute what? Congestive heart failure. And just as we have in the thiazide diuretics, they're also used in what? Congestive heart failure, hypertension, of course, edema. Of course, when you mention edema, even though not all congestive heart failure, but whenever there's edema, our mind will surely go there to ensure that it hasn't gotten to what? Congestive heart failure. But when you have acute congestive heart failure, and when we have edema, and when we have hypertension, a very important indication is in pulmonary edema. Very important. Pulmonary what? Edema. Remember in our last class when we mentioned edema, when the fluid, the blood that comes from the fluid, of course, blood is fluid that comes from the lungs via the pulmonary vein, trying to enter the atrium from left atrium to the left ventricle. But because of the inability of the left ventricle to pump everything presented to it by the left atrium in congestive heart failure, then there was accumulation of fluid in the lungs. So this we cause what? Pulmonary what? Edema. So this, please let's know that point. These loop diuretics are also used in what? Pulmonary. Apart from the edema, apart from the edema and the acute congestive heart failure, hypertension, they're also used in what? Pulmonary edema. Pulmonary edema. Okay, so and also in nephrotic what? Syndrome. Please, most of the things I mentioned here, I've already mentioned them under thiazide diuretics. The only two things I added are what? Pulmonary edema and what? Nephrotic what? Syndrome. Pulmonary edema and what? Nephrotic what? Syndrome. Now, what are the examples of these loop diuretics? What are the examples of these loop diuretics? The most popular of them all is what? Furosemide. Furosemide. The most popular of them all is furosemide. Furosemide. That one is popular. Furosemide. So, of course, it's true that I don't like going for brand name, but we know that our popular Lasix, our popular what? Lexis. That one is the most popular brand. Alright, so furosemide comes as tablets, also comes as what? Injection. But the one in this part of the world are what? The injections and the tablets. I say that it also comes as what? Solution per orally. So as tablet was 20 milligram, 40 milligram, and even what? 80 milligram. 20 what? 80 milligram. Then as injection, every time what? 10 milligram per ml injection. Every time 10 milligram per ml, yes. It exists as 10 milligrams packaged as presented as 10 milligram what per ml. Okay, so for oral solution, we have it as 10 milligram per 5 ml. Those have it at 40 gram per 5 ml. milligram per 5 mil, 40 milligram per 5 mil. Then for edema, the average daily adult dose is around 40 to 20 to 40 milligram. 20 to 80 milligram per hour per day. 20 to 80 milligram. Then for injection, we have it as what? IV, BID twice daily, 20 to 40 milligram twice daily. 20 to 40 milligram twice daily. That one is for what? But for hypertension, 40 milligram, 40 milligram twice daily. 40 milligram twice daily as what? As what? Either solution or tablets per orally. Okay, so we have other ones. We have our tosemide. Tosemide is also down here. Tosemide. We have tosemide is also there. Then we also have the one. Excuse me. Okay. So we have bumetanide, we have furosemide, tosemide, and the bumetanide. Okay, so for tosemide, we have it as what? 5 milligram, 10 milligram, 20 milligram, and 100 milligram. 5, 10, 20, and 100 milligram what? Tablet. The average daily dose per hour is 20 what? 10 to 20 milligram. That's for the bumetanide. Rate at 5, 10, 20, 100 what? Milligram. 5, 10, 20 what? 100 milligram. Okay, so then that is for what? Tosemide. This is for what? Tosemide. This is for what? Tosemide, not bumetanide. This is for what? Tosemide. Then 20 to 40 milligram per hour per day. 20 to what? 10 to 20, not 20 to 40. Then we've discussed furosemide. Then for tosemide, for bumetanide, is 0.5, 1 milligram, 2 milligram tablets. It also exists as injection, 0.2 per mil, 0.2 milligram per mil, 0.2 milligram per mil. That's for what? Bumetanide, 0.2 milligram per what? Mil, 0.5 milligram. The injection is, this is injection, 0.2 milligram per what? 0.2 milligram, 5 milligram per mil. Okay, so these things are in different reference books. You don't need to cram them. Just to the reference books, and you learn that by practice, having handled them over a long period of time. It's even better to, in practice, to look up from reference instead of, there's no way you can carry all of them, memorize them. There are very else you can always look up in your what reference book. So as a practitioner, as a pharmacist, a pharmacy technician, always have a reference book by your side, especially the clinically oriented one, where you can look up these things and be able to dispense or fill prescription properly, or even make recommendations when the need arises. Okay, so I said that between bumetanide is what we have 0.5 milligram, 1 gram, 2 milligram on the tablet, then 0.25 milligram per ml injection. So for adult dose per orally daily 0.5 to 2 milligram, while for injection, which can be IM or IV, is at 0.5 milligram to 1 milligram. But the maximum daily dose should not is 10 milligram. That means the dose per day should not exceed enough. The dose per day should not exceed what? 10 milligram. The dose per day should not do what? Exceed 10 milligram. Bumetanide. The dose per day should not exceed what? 10 milligram. Very important point. Very important point to note. Okay. Okay, so the next one I want us to look at is potassium sparing diuretics. From the name, what does it imply? Potassium sparing diuretics. What does that imply? What does that imply? Is they spare what? Potassium. They spare what? Potassium. You know, there's tendency of while water is lost, there's tendency for important electrolytes to follow suit. But this one, in as much as it leads to loss of water, elimination of fluid, as they eliminate fluid, they do what? Retain or spare potassium. Very important. As they eliminate fluid, they spare potassium. So they allow water loss without loss of what? Potassium. Very, very important. Of course, if you can remember what we discussed in heart failure, congestive heart failure, how hyperkalemia and hypokalemia affect the what? The cardiac what? Contractility. So when potassium is lost, we have hypokalemia, and it's a problem. Is a what? Problem. So low potassium level will lead to what? Weak heart muscles. So, and when that happens, the pumping of the heart, the contraction and the pumping of the heart and the pumping of blood will become what? An issue. And when that cannot happen, it will exacerbate what? Congestive heart failure. Remember the target you are trying to treat, manage as case may be, congestive heart failure and hypertension. So when you now trying to remove the fluid and potassium goes to, it becomes a problem. It becomes a what? A problem. So hypokalemia will lead to what? Weak heart muscles, and the heart will not be able to contract enough to be able to pump out blood. While hyperkalemia, good, we mean that we have enough potassium to be able to be able to do what? Cause what? Contraction of the heart muscles, at the same time leading to what? Pumping out of what? The blood. So there's need for that potassium to be what? Spared. So that's what the potassium sparing diuretics do. So sometimes these drugs in combination, these drugs with other drugs. Okay, we'll go there. Also, that basically what happens. You see thiazide diuretics being combined with what? Being combined with loop diuretics, or you see potassium sparing diuretics combined with any of this. Okay. So what are the examples of these potassium sparing diuretics? What are the examples? What are the examples? The popular one among them, most popular one among them is spironolactone. Spironolactone. This one is also used in yes, special accumulation of in terminal stage. When people start getting to the liver issue, you see inflammation of the abdomen. Let's continue. Let's go there. Just also use with these so that's okay. This time let's we have triamterene basically the combination spironolactone phosphate 25 milligram, 50 milligram and 100 milligram tablets. Spironolactone 25 milligram spironolactone. 25 milligram, 50, 100 milligram watts. In edema, average edema, 55 watts, 100 watts, milligram. In average, 25, I will call it that of hypertension. In edema, 5 to 100 milligram. In hypertension, we have it as can be used on daily basis between 50 and 100 daily dose. Edema, 25 milligram to 200 hypertension, 50 to 100 watts milligram. Oxy that is presented as tablets 50 milligram. That's what spironolactone. Then what of triamterene? What of triamterene? So we have it as what? It as what? 50 milligram tablets. So capsule. Tablet. Capsule. 50 milligram capsule. 100 milligram what? Capsule. Is 100 milligram ID twice a day. 100 milligram twice a day. But the dose of triamterene is what? 300 milligram per day. So a day you should exceed 300 milligram. But if you're taking 1 milligram twice, 300 watts. So it goes in a tablet is prescribed up to 1 to 8 tablets daily, depending. 1 tablet daily. That spironolactone at 50 milligram, 50 milligram tablets daily, reduced because of the high stress. Reduced. Spironolactone hydrochloride 1 to 4 tablets daily. Okay. So we also have with hydrochloride. This and combine. Okay. So that is 25 milligram, 25 milligram, 1 to 10, 50 milligram, hydrochloride 50 milligram. we have to note those things. Okay, so what actually happened that today's potassium sparing diuretics say this is not how deep this is. Each of them go into the pharmacology, starting from the action, generic environment, making action, go down to dosage, medication, down to actions, but I'll be showing all things at the terms of the scope, the concept. So now let's look at carbonic inhibitors. Carbonic inhibitors use ophthalmological variations mainly. That's where because of the action. The action is more pronounced in the way eye. So we have the carbonic anhydrase. So carbonic that's carbohydrates inhibitors. Anhydrase. Carbonic anhydrase. So what does this anhydrase do? So let's look at this carbonic anhydrase as an enzyme. So carbonic anhydrase so anything will affect the to what? Some of the what? The what? When we have the equation, we have the anatomy of the eye and physiology of the eye. The pressure there should not be too much. If the pressure there is much, it will cause issues. It's not cause issues and have you. So to avoid that, this carbon anhydrase basically they inhibit the what? The enzyme inhibit the enzyme carbonic anhydrase, resulting in the what? Reduction of the amount of aqueous humor. So amount of aqueous humor, if the amount of aqueous humor is decreased, the ocular pressure will also do what? So the target of this class of category of this category of direct is to do what? Reduce the what? Reduce the what? The intraocular pressure by attacking or inhibiting actions of what? 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 Iris. Okay. Apart from that, there are other symptoms, there are other effects this may have, but the one that are more pronounced is in the what? The eye. So most of the drugs here, most of the drugs I'm going to mention here have effect in the what? The eye. Okay? Although not all of them, not all of them. So, all right. So we look at the most popular one is acetazolamide. The most popular one is what? Acetazolamide. The most popular one among these is what? Acetazolamide. So remember that inhibiting the action of carbonic anhydrase will do lead to decrease aqueous what? The amount of aqueous more, like subsequently is the what? The intra what? Ocular what? Pressure. So this is the action that makes these carbonic anhydrase inhibitors to be used in the treatment of what? Glaucoma. If you study about glaucoma, well, you know that they have a lot to do with what? With the what? Increase in what? Ocular pressure. Intraocular pressure. Because a high concentration of the what? The aqueous what? Hormone. So this will also, when this comes down, this pressure will do what? Come down. And when the pressure comes down, then the glaucoma will be taken care of. Then apart from that, you also have this. I think I made okay. I've not mentioned it's like motion sickness and what have you. Motion sickness symptoms. So let us not waste our time here. So I think I mentioned of what azoramide. The most popular brand worldwide now is Diamox. Diamox. I wouldn't like to go into these brand names, but sometimes it's good to mention the Diamox. Okay. I think add that spironolactone, add that tone. Okay, let's continue. So that's for this acetazolamide. What is the strength and how does it come? Acetazolamide tablet popular in this part of the country. I am tablets. We have it at 125, 250 is the most popular strength here. 250 milligram diamonds. 250 milligram tablets. We also have it as 125 milligram tablets. Then 500 milligram. We also have it as capsule, SR, sustained release. SR, sustained release, 100 milligram tablets. We also have it as what? 500 milligram tablets. We also have it as what? Even injection. Okay, we have it as what? Injection 2. So, but the one that is the most popular here is what? Tablet acetazolamide 250 milligram. So we also have it as what? Injection, powder for injection 500 milligram. So they are for adult daily dose average. In average, we have 250 to 1000 milligram in divided what? Doses. In divided what? Doses. Then we also have methazolamide. This one is acetazolamide. Aceta. Please note these suffixes. Prefaces. Aceta, acetazolamide, methazolamide. Acetazolamide and meta what? Zolamide. Acetazolamide and what? Metazolamide. This one we have it as 225 and 50 milligram tablets. Metazolamide, 25 and 50 milligram tablets. Then average daily dose is 50 to 100 milligram. Average daily dose is 50 to 100 milligram. Can be taken twice daily or 3 times daily in divided dose. 50 to 100 milligram. 50 is not divided dose, it's 50 to 100 milligram twice daily. B or what? TDS. AID or TID. Okay. So these are the four major diuretics I want us to look at in this topic. So this whole thing in all, the aim is to do what? Eliminate fluid. Eliminate fluid. Remember that there's a group that as they eliminate the fluid, they also do what? Retain what? Sodium or spare what? Spare potassium. Spare potassium. So when fluid is eliminated, then the pressure on the blood will do what? Decrease. So That's why they will take it free, that they're taking care of the what? The hypertension. Then, but the spare one will need to be potassium to be able to do what? Give more strength to the what? The muscle to contract and be able to what? Pump out more blood that are accumulated in the what? In the what? In the hearts. And once the heart can pump well, other edema, generalized edema, peripheral edema, peripheral, and one the pulmonary edema, because it will be well redirected to the heart where the circulation will continue. So that's what basically analytics do. So as I see before, I was the things I am talking pointing after the other without going deeply into any of them. So this is the scope on this course. Class will come to dilators. In our next class, we continue with also dilators. If we know that anything today, we learn of each of these and how they are presented. They are those ones the average this level. So by the time we go into pharmacology, as we now pick one of them, pick it deeply into how will be another day. When the time comes, you will know. Please always check the TikTok on daily basis. The topics for the day will be what will be posted. Check on daily basis. If you have any question, please feel free to ask any question on any of these drugs. Please feel free to ask personally. Then I'll create time to explain. Then you can chat me up on WhatsApp. My WhatsApp line is on the screen. Check the previews of the lecture on the TikTok. You see the WhatsApp when they pick it. Feel free to drop your question. Okay. All right. So we'll stop here for today. Please, if this time come back for this pharmaceutical collection, please stay with us. God bless you. See you next time.